Okay, so today I am going to differentiate some very common cardiac remedies which are useful in cardiac failure. Today in the webinar you learned some remedies like Lycopus from other snake remedies like Naja and Lycopus. Do you remember? Then we discussed Lauracerasus. Now I am going to all remedies like Arsenic, Antim Tart, Carbo Veg and Oxalic Acid. Take this remedy very quickly if you know some very cardinal features of every remedy. And for that you need two things: a good knowledge of materia medica, a homeopathic physician who has used this remedy hundreds of times and who will guide you. Can look, this is the symptom which has been verified many times, because many times what is written in materia medica is not seen in the practice. Like today we discussed with you tumultuous action in the heart. Nobody will get this symptom directly. It's an indirect way. So similarly, if you are going to look at arsenic in a heart, thing to remember is arsenic never cures heart failure. And this drug needs to be supported by another drug immediately in next 12 hours. If you don't support arsenic with another remedy in the next 12 to 24 hours and keep on continuing the same remedy, be responsible for the death. So if you are not very skillful, if you are not very experienced, don't touch that case. Refer it to a senior who is very skillful, or else keep this point in mind. But somewhere arsenic helps. First you should look for mental distress. Now again, the patient is not going to complain to you the word mental and then distress. So he is not comfortable. Not comfortable mentally. Not comfortable in his current situation. Not comfortable with his disease. Not comfortable with his symptoms. This is mental distress. Nothing suits him, nothing pleases him. And to add to this mental distress, extreme fear. So you learned two things from me just now. Mental distress, extreme fear. Third point, extreme anxiety. Mental restlessness, fourth. Physical restlessness, 5. Constant thirst, 6. Desire for 6 of ice cold water, 7th. Eighth symptom, feeling of extreme cardiac pressure. There is a pressure in the area of. And how will the patient say like? He will say, I cannot breathe deep enough. Deep enough. And because I am not able to breathe deep enough, this is the core indication of arsenic in heart failure. Don't look for any more symptoms. You will not get it. If you think that you are going to get 40 lines of acute symptoms of arsenic, no, you will not get it in practice. But whatever you will get is from these 8 to 9 points which I have suggested to you. Next point, very chilly, but at the same time they complain of burning sensation in the chest. Lips are grey, never pale, into bracket never pale. So whenever there is a grey, think of early cyanosis. So write down grey dash early, and they give you an impression that they are extremely. The expression is pinched. The face looks pinched, wrinkled, and the discoloration of the face is grey. Arsenic attacks comes very suddenly. Little unwell in the evening, by the time it's midnight, it's severe aggravation. But remember, it heals also very quickly if the remedy is correct. After giving arsenic, if you do not get response in half an hour, don't increase the potency, don't repeat the remedy thinking फायदा होगा. No. Arsenic acts very fast. You give here, in 20 minutes there is a response. Now let us see the evaluation of response. That's very important. Now I am teaching you all this, the practical part. So anxiety becomes less. May not be the physical symptom becoming less. The anxiety becomes less. The fear becomes less. The restlessness becomes less. And he feels little warmer. These are the indications that arsenic is acted beautifully on the patient. And now you are in that safe zone to think of another remedy. Remember? To pull through the whole crisis. Don't wait till he says, now I can breathe comfortably. No. Patient has already started improving. You keep this in mind. I have seen so many cases where arsenic was given in our homeopathic hospital by other physicians. They never knew this mechanism. They thought arsenic is a very deep acting remedy and carried through the failure. The patient dies next morning. So don't do that. I have seen some bitter lessons. If you want to remove those, you need a push. You need another layer. Sometimes you will have to repeat arsenic frequently also, but that is in a very rare case where we give every 15 minutes to half an hour. So what is another remedy and what kind of remedies can follow? Can we predict this as a homeopath? Yes. 40% you can predict. Here the complementary relationships given in concordance repertory of Bogobonigushin will help you. But that's only 30 to 40%. For majority, you will have to find out the remedy that can cover and prevent the secondary collapse, which is going to follow very soon. So, when will this secondary collapse come? That's the golden question. Usually comes between 6 to 10 hours after the arsenic symptoms have subsided. Mostly, if the patient is still chilly and has not become very warm, phosphorus will come in a big way to support arsenic. If the patient is getting warmer and warmer and warmer, then sulfur will come. So as you can see the picture of sulfur emerging, there will be an irregular waves of heat in different parts of the body. The blanket which patient had taken in arsenic, they will throw out, and a slow air hunger will develop. After half an hour, the patient will say, put on the fan, put on the air condition, open the door, open the windows. If you get this air hunger picture, patient is going towards sulfur and not phosphorus. Because sulfur is a very strong air hunger. Now, again there will be a problem, because if there is an air hunger, sulfur is not the only remedy. There are many remedies. And the remedy that mimics sulfur a lot in an acute heart failure after arsenic is Antimony Tart. Antim Tart also has an air hunger. But with Antim Tart, you have more cyanosis, which is lacking in sulfur. Cyanosis, you should look in fingernails, extending to the palms, and finally the feet may be involved. The anxiety by the time the patient comes to Antim Tart has almost disappeared from that arsenic case. In fact, now in Antimony Tart you will see a lot of depression and hopelessness. Now nothing much can be done, doctor. Shift me to the hospital. Call the allopathic doctors to help me. So this is hopelessness, this is depression. Do you follow? Doctor, I think so now it's enough with homeopathy, call somebody else. Call somebody senior. What does it indicate? Hopelessness, depression. This is where your picture of Antim Tart will start and arsenic will end. In arsenic anxiety, doctor, what is wrong with me? Doctor, what do you think? Doctor, how bad is the damage? Doctor, what is my pulse? Doctor, what is my pressure? Doctor, please can you examine my blood pressure every half an hour? See, this kind of question will come. Now there is no this kind of question. He's strictly telling you, admit me in hospital. Doctor, if you can't manage, don't worry. You have done enough for me. So there is no restlessness. And then none of the thirst that you saw in arsenic, extreme in sips, is existing now in this stage. Once you come into Antim Tart, in fact, if you try to drink water, it brings severe distress to all your heart failure patients. Now this is a big contrast. You can never make a mistake. Here you saw somebody drinking sips every 5 minutes. Here this man does not feel thirsty, but if he tries to drink water, I tell you that he is going into severe aggravation. Plus, you have given a lot of warmth to the arsenic patient in the beginning, blankets and everything. The more heat you give to Antim Tart, more he goes into aggravation. The stuffiness of the room. Now, as you are thinking of Antimony Tart, with all these symptoms, another picture will come. Is it not Carbo Veg now? Because air hunger again, see, it's not very straightforward. I am purposely trying to bring drugs with you, comparing with you and differentiating for you. So now what should I do? Now what is the difference? Carbo Veg wants air with a force directed towards you in one direction. And that has to be a cold air, not a warm air. But in Antim Tart, they want a cold air, but they want a still cold air. Still means the whole room, the whole area has to be equally cold and not just localized on your face, not just localized on your body. So it's like central air condition is better for Antim Tart, but a window air condition is better for Carbo Veg. Very good. You saw how you were able to differentiate? Then the second point which goes in favor of Antim Tart is the edema of the lower limb, which starts developing very early. Third point in Antim Tart is thickly coated tongue. white coat, sticky mouth, fullness in the chest, cannot breathe. That is totally different from what Arsenic said. What did Arsenic say? Constriction and heaviness. Here he is talking, everything is full, I feel I cannot expand my lung. I cannot take breath. I cannot do proper inspiration. When you examine, put your stethoscope in Antim Tart, generalized diffuse rales, especially on the base, on the lower part and on both the sides. Arsenic you will see more on the anterior part of the chest, anterior part of the lung. See how close observation. Now there is a difference. In the Arsenic I said if the patient feels better, what you should do? What should you do? Change the remedy and support. So you don't have to be as a policeman to change the remedy or change the drug because this can continue. But let's say that you gave an Antimonium Tart and the symptoms are changing. There is a cold sweat now. Patient has become more dull and confused. In Antim Tart, what did we say mentally? What symptoms we were describing? Correct. Now the same person is confused. What is the time? And he'll make mistaking time. What is this? So who is standing next to me? He will be able to confuse in the names. Where am I? He may not know. So foggy outlook. Not very clear in idea, not very clear in what he is talking. Not very clear in what is happening to him or what will happen to him. Now this is not an Antim Tart state. He is slowly sliding into Carbo Veg state. So to learn practical homeopathy, knowledge of only materia medica is useless because what is written in the book will remain in the book. What is written in the book will remain in the book. What you see on the bedside, the change, the application, what we call as applied materia medica, that is a practical part. Your book knowledge will not help you. And now as the person goes into Carbo Veg state, we told you about cold clammy sweat, we told you about coldness of the skin, we told you about air hunger. Then comes the clothes around the neck. And what kind of clothes will come around the neck in sick patients? What is the thing that you bring near the neck in sick person?
Like towel.
The blanket. The blanket. We will tell the nurse, please put the blanket only below my abdomen, not all the way up, as I cannot bear any clothes around my neck. So that the oxygenation is more comfortable. Then comes another part of Carbo Veg that is coming in, bloating of the abdomen, especially upper abdomen. Now the trick, the practical trick. More the bloating, more the cardiac distress. So what he is going to tell you, doctor, first do something for my this. I feel then my heart symptom will be better. Doctor, let me pass some gas. Doctor, let me do some eructation. Let some gas come out. I'll be having much relief. So more the flatulence, more the aggravation, less the flatulence, complete disappearance of the cardiac symptom. Now even a newborn A new one who is introduced to homeopathy will think of Carbo Veg because flatulence and upper abdomen, correct? But see how we have come. Flatulence doesn't come on the day one. Flatulence doesn't come in the beginning. After all that stages have passed, the flatulence will come. So don't expect the whole picture in one day. Because the person has to evolve, the disease has to evolve, your vital force has to unfold to bring out that kind of picture. So again we go back to Antim Tart and we said Antim Tart does not like water much. Rather if he drinks he goes into, but also eating. So Antim Tart if he eats and drinks, he invites distress. And they don't have any thirst as compared to arsenic. Now, going back to Carbo Veg. See, now all the pictures are going from one to another, so I have to differentiate. So we just now said that he doesn't want the blanket till the neck. So what does he tell the nurse? Put the blanket. But then, if you are covering your lower part of your body with a blanket, what should be your legs? Hot or cold? Hot. But in Carbo Veg, it is icy coldness of the feet even though covered with blanket, right down. And the legs become so heavy like a lead, and you try to put 10 blankets on the feet below the on the lower limbs. The patient will say, it's not so warm, it's not so warm. So now you know it's Carbo Veg. You will give Carbo Veg. The first symptom is it starts becoming warm in the legs. That means your remedy is correct. But now Carbo Veg also has the same game plan of arsenic. It will not carry through the case. So don't keep on giving medicines, higher potency, repeated dose, thinking the picture is benefited by Carbo Veg, so let's continue. No, secondary collapse will come. So now you all learn two remedies with me which need secondary support to prevent secondary collapse. What are they?
Arsenic and Carbo Veg.
Carbo Veg. And the remedy that mostly supports Carbo Veg is Lycopus. The remedy that mostly supports Carbo Veg is sulfur. Understood? Now the last remedy for the day, and that is Oxalic Acid. A wonderful remedy. Now, if it is an acid, what is the characteristic symptom of all acids?
Frustration.
Yes?
Frustration.
Weakness, exhaustion. But then you will say, come on, arsenic also has it. Then somebody will say, okay, now differentiate exhaustion of arsenic with oxalic acid. And you will say, oh, arsenic is restless and anxious. I agree, but those are associated. Can you say something about the weakness of arsenic?
It is out of proportion of the disease in arsenic.
It is out of difficult.
For example, the patient is suffering, got 3 diarrheas. He will be as weak as he got 10 diarrheas.
But now we are talking about, so here, for oxalic acid, weakness is always accompanied by numbness. The legs are numb, the legs are paralyzed, or sensation as if there is no legs. When you get with this, of course, not very commonly seen. Oxalic acid picture is not as common as arsenic picture. But if there is a numbness, I will hardly think of arsenic. Follow? The skin is cold and clammy, so now I am destroyed. Why? Because it is still Carbo Veg. Now how will I differentiate? Because oxalic acid also has got cyanosis like Carbo Veg. So how will I differentiate? The difference is Carbo Veg has a generalized cyanosis. Oxalic acid has a molted appearance of the skin. You know molted? You know the meaning of the word molted? Molted means what? Wrinkle? No.
Patchy.
Patchy. So molted appearance on the face, especially along the malar bones. This is more of oxalic acid. Any movement will aggravate oxalic acid. Now, which other remedy you have studied just now where slightest motion aggravates among all the remedies that we have discussed so far? Arsenic. Arsenic. Just now she said no. Exhaustion out of proportion. So arsenic. So again you will think, "Arey, is it not arsenic?" So now how to differentiate? Sharp precordial pains, stabbing pains, comes from the back, runs to the left side of the sternum, clavicle, and all the way to epigastrium. So comes from the back, goes to the chest, epigastrium, and whole left side. That's oxalic acid. And then most of the oxalic acid patients may also have associated pneumonia. Okay, so this is how you have differentiated some remedies. There are about 40 remedies which I have made a lecture on cardiology. So today you learned at least how many? We did arsenic, oxalic acid, Carbo Veg, Antim Tart in the morning, Kalika, Lawrence